I'm good. How are you?
Good. What's your name?
My name is Natalie.
All right. Have a seat, Natalie. What's your birthday?
10/15/98.
So you're 20?
Mm-hmm.
That's good. Are you in school or working?
I'm in school.
Where do you go?
Colby Sawyer College.
Do you like it?
It's okay.
Yeah, it's going well. What brings you into the office today?
I'm here for a physical assessment.
Okay, and are you in any pain at all?
No.
So from a scale from 0 to 10, 0 being no pain, 10 being the worst pain, where would you say you're at today?
0.
0? Okay. So I'm going to start with your head to toe assessment, starting at your head. Let me know if at any point something becomes too much for you or uncomfortable, or if you have any questions. No lumps or bumps. Tell me if you can hear this.
Mm-hmm. Mm-hmm.
Good. And can you raise your eyebrows for me? And smile and frown. And can you close your eyes and not let me open? Good. And can you clench your jaw? Perfect. And can you move it for me? Good. And don't let me open your mouth, okay? Good. And can you push against my hand? Good. Good. I'm just going to feel your pulse. Good. So I'm going to start with your eyes, okay? So first, can you mirror me? And let me know when you see my finger in your peripheral vision.
I can see it.
Perfect.
I can see it.
Good. And we'll switch eyes here.
I can see it. I can see it.
Good. And then can you please follow my finger with only your eyes, not with your head, okay? Any dizziness with that?
Mm-mm.
It was comfortable? All right, I'm going to shine a light in your eyes. Can you tell me if it's too much for you or if it hurts at all? Good. Now the other side. Good. And do you see an eye doctor regularly?
I've never had to see an eye doctor.
Do you have any glasses or contacts?
Nope.
No problems with your vision?
Mm-mm.
Alright. So I'm going to have a peek in your mouth. Do you see a dentist regularly?
Mm-hmm.
Yeah. Good oral hygiene? That's good. Alright, can you stick out your tongue? And to the right, and to the left, and to the roof of your mouth. There you go. And I'm going to look in with my light. Say ah. Alright. And now I'm going to palpate your gums. Can you let me know if it becomes uncomfortable for you? Good. And can you say light, tight, dynamite?
Light, tight, dynamite.
Alright. And can you puff out your cheeks for me? Good. Alright. Just gonna feel your trachea. And can you shrug up against my shoulders and then down? And can you put your chin to your chest and then up towards the right side? Good. And towards the left and then back. Any pain with that?
No.
No discomfort?
Mm-mm.
Alright. Your temperature feels good. Nice and dry. And can you put your arms out for me? I'm just going to feel your pulses. Good. Good. And can you push up against me? And then down against me? And then can you put your arms like this? And then could you bend your arm? Good. And then push down against me. Perfect. Now we're just going to do some range of motion. Can you put your hands above your head? Out to the sides, down, out behind you. Can you do big circles? Any pain or discomfort with that?
No.
Alrighty. Can you swing your legs around? I'm going to start your posterior chest. Perfect. You feel warm. Are you comfortable?
Mm-hmm.
Okay. When I put my palms on your chest, can you please say 99?
99. 99. 99. 99. 99. 99.
All right, and can you take a big deep breath in and out, please? Good. I'm going to lift this up just a little bit. Good. So I'm going to have a listen, and every time I put my stethoscope on your back, can you please take a big deep breath in and out of your mouth?
Mm-hmm.
And let me know if at any point you become uncomfortable or you need to take a break. Just let me know, okay? Alright. No discomfort with any of that?
Mm-mm.
And do you have problems with your breathing?
Nope.
Nope? Okay. Can you swing your legs back around for me? So no coughing, no wheezing, shortness of breath?
Nope.
You never wake up in the middle of the night feeling uncomfortable at all?
Mm-mm.
Unable to breathe? Alright, so now we're going to repeat the same thing you did on your back, on your front, okay? So can you please say 99 for me?
99. 99. 99. 99. 99. 99.
Alright, and can you please take a big deep breath in and out? Good. You still feel warm. Good. Can you move your arm just a little bit? Perfect. Thank you. And now I'm going to have a listen again. And like I said before, if you need to take a break, just please let me know, okay?
Okay.
And I'm going to start up at your throat to see if I can hear any bruise. Alrighty, everything sounds good, so I'm going to move down to your lungs. I'm going to listen down below. And on the other side. Good. No pain with that?
Mm-mm.
Alright. So I'm going to have you lay back for me. I'm going to put this out so you're a little bit more comfortable. And can you please please turn your head to the side? Perfect. And the other side, please. Good. And I'm going to look for your apical pulse. I don't see it, but that's perfectly normal because I can feel it. So now I'm going to have a listen to your heart. Have you ever had any heart problems, conditions?
Nope.
Anything make you uncomfortable, heartburn, nothing like that? All right, now I'm going to do your apical pulse, and I'm going to stay here for a full minute, okay?
Okay. All right, and your heart rate was 71 beats per minute, which is very good. All right, I'm gonna move down to your stomach, okay? Do you have any stomach problems, pain, uncomfortableness, regular bowel movements? All right. I'm gonna start by listening, okay? I'm gonna pull your shorts down just a little bit. Everything sounds good, lots of vowel sounds. Now I'm going to percuss, okay? Your aorta was also very strong when I was listening. And now I'm gonna palpate your stomach. So I'm gonna start with a light touch. Let me know if anything becomes uncomfortable. And now I'm gonna go into a deeper palpation, so please let me know if it becomes uncomfortable. Looking
at your head and your face. So looking at your skull contour, you're rounded and you're firm, okay? And looking at the symmetry of your eyes and your nasal and your mouth and your eyebrows are all symmetrical. And then I'm going to be feeling your axillary here and your frontal sinuses. Any tenderness?
No.
No?
No.
Okay, so no tenderness noted there. Then I'm going to be looking for your TMJ. So I'm going to be placing my fingers right here and open and close. Any pain?
No.
So no pain with TMJ noted. Then I'm going to be looking at your CN5 and 7. So can you squint your eyes for me? And raise your eyebrows. Smile. Bare teeth. And puff cheeks. Pop. Good. So CN5 and 7 intact. Then I'm going to be looking at your lymph nodes. Okay, so your pre and post auricular lymph nodes are right here. Any swelling? Tenderness?
No.
Okay, I don't feel any swelling. Okay, and then I'm going to be looking at your supraclavicular lymph nodes. Any tenderness here?
No.
No? No swelling. Your submandibular lymph nodes here. Any tenderness?
No.
No? Okay, and your submental tenderness?
No.
No swelling noted. And your cervical chain nodes right here. Tenderness?
No.
No? No tenderness noted. Okay, very good. Next, we're going to be moving on to your eyes. And I'm going to be looking at your pupils and to see if they are equal and round, which they are, and if they're reactive to light. Very good. Okay, and I see it constricts with light. That's good. And I'm going to be looking at your conjunctiva, which is right here. Moist and pink. And then your 6 cardinal signs for the CN 3, 4, and 6. So just follow my finger. Good. Okay, so CN 3, 4, and 6 are intact. Now I'm going to be doing your ears and looking at the placement of your ears. And so I would have to say they are bilaterally symmetrical in your face. Then I'm going to palpate the pinna and the tragus. And yours is pierced right here. Okay, so they're firm and intact. Then I'm going to have the otoscope, and it's going to be upside down, and I'm going to pull your ear, your pinna back and up. And so have my pinky like this, hold it upside down, up and back, and look inside of it. And to see if you have any exudate or the tympanic membrane, which is going to be a pearly gray color. Okay, and next after your ears, I'm going to go into your nose, and I'm going to see if your nasals are symmetrical. Okay, and your mucosa is moist. And for patency, can you hold one side and breathe out the other? Okay. Very good. And then I'm going to be looking at your septum to see if it's deviated. Okay, so your septum is not deviated. And your turbinates, which are the ridges in your nose, and that is when you breathe in, those moisten and warm up the air so it's not so harsh and cold and dry on the back of your throat. Okay, so those are a darker pink color. Now moving on to your mouth. So can you open up your mouth for me, looking at the mucosa? So you are pink and moist. Very good. And stick out your tongue for me. Very good. Midline, okay. And your teeth smile. They are white and straight. And let me see your ear overbite. Okay, very good. So your top teeth go over your bottom teeth, which is good. And then going to be looking at your uvula in the back. Okay, it's intact and dangling in your pharynx in your back. There you go, thank you. Very good, which is moist and pink as well. And then looking at your CN10, which with your tongue depressor, I will put on your tongue and make you say the ah noise, ah, and that is where your soft palate is going to rise and your uvula will shake, which is generally good. And then your gag reflex, which we won't do here, only in a clinical setting. I won't gag you right now. Okay. Okay, so after the mouth, I'm going to be moving on to your neck, and we can't do this right here, but generally you would be at a 45-degree angle. So just to show a little bit, just go back just a little bit. Okay, so I'd be looking right here to see if any distension or any abnormalities right here, and I don't see anything, so no JVD noted. Then I would be looking at the carotid and feeling it right here and here. And you don't want to do them at the same time because you don't want to pass out. But they're bilaterally symmetrical, and I would say 2+. If I was listening to them with my stethoscope, I would say no bruise noted. Okay, and then after that, I'm going to palpate your trachea. Any tenderness here?
No.
No? Okay. And I would say it is midline. Very good. And after that, I'm going to check your CN11. So can you shrug your shoulders for me? Very good. And your range of motion for your neck, which is, can you look at this way? This way? Up and down. Now, ear to one side, ear to the other side. So you have full range of motion with that. That's good. Okay, so now after the neck, I'm going to be moving on to your heart, and the 5 heart sounds I'm going to be listening for are your rate and rhythm, your S1 and S2 together, S1 and S2 separately, extra sounds, and a murmur. And your 5 placements, I'm not going to put my ears in because I want to be able to talk to you. So you have your A, P, E, T, and M. With your aortic placement right here, that's going to be your second intercostal space with the right sternal border. Your pulmonic is your second intercostal space, the left sternal border. Erb's point is your third intercostal space, left sternal border. Your tricuspid is your fourth or fifth intercostal space, your left sternal border. And your mitral right here is your fifth intercostal space, your left midclavicular line. Okay? So done with your heart sounds. Now I'm going to be moving on to your lungs. So do you mind turning around for me? Sure. Okay, and I'm going to be doing the thoracic cage expansion. So I'm going to put my hands here. Can you breathe for me? Deep breath. Very good. One more time. Very good. And I just want to see that they do expand. So your lungs are bilaterally symmetrical. Next, since you're turned around, I'm going to do the 18 placements on your back. So I'm 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, and 18. And the reason why I curve up at the ends is because you have a shorter torso, and so I don't want to get too low down here because I want to hear just your lung sounds. Okay, can you turn around for me? And I'm going to be doing your anterior sounds. And there's 10 in the front. So 1, 2, 3, 4, 5, 6, 7, and 8, 9, and 10. Okay, and after that, I'm going to be looking at your right, which you have 3. So I'm going to come over here, lift your arm if you're okay with that, and listen for your 1, 2, and 3. Your 2 is more in the front because that one is in between the 2 here, so it's kind of pushed towards the front, and the third one's towards the back. And your left only has 2 spots, so the placement for that, we'll lift your arm if you're okay. 1 and 2. And if I was really listening with my stethoscope, I would note any adventitious sounds, such as wheezing, stridor, rhonchi, or rales, which are all not very good. Okay, so moving on, we're going to go to the abdomen. So if you don't mind laying down for me. Okay, and I'm going to bring your shirt up real fast. Okay, so the general contour of the abdomen is relatively flat, okay? Then I'm going to be listening for the aortic pulsations, and generally for a thinner patient, they're going to be stronger. So we'll see right here. And you have faint aortic pulsations. Next, we're going to be listening for any bowel sounds, and you're going to start in your right lower quadrant, then move on to your right upper quadrant, left upper, and left lower, going around. And if I didn't hear any sounds, I would do 5 minutes in each quadrant just to see if I could hear anything. And if I didn't, then I would be a little more worried about that. And then I'm going to palpate, okay? Any pressure? No. Okay. Good. So you're soft, which is good, and you're not firm.